Today we are going to talk a little bit about Senate Bill number 1287, an Act Creating Autism Teams in Hospitals, and the potential impact it may have on occupational therapy. During this presentation, we will discuss the bill itself, the goals, the history and development, and the interested actors and players. We will also do a quick analysis of this policy as well as discuss the policy's impact on occupational therapy. Senate Bill number 1287, an Act Creating Autism Teams in Hospitals, will expand current hospital-based medical providers' knowledge about autism and intellectual and developmental disabilities to improve the treatment individuals receive in medical settings. If passed, this bill will become law in the state of Massachusetts. The primary petitioner of this bill is Massachusetts State Senator Jason Lewis, a Democrat from the 5th Middlesex District. The passing of this bill is important because hospital admissions for patients with autism spectrum disorder are on the rise, yet little is known about these patients' care and experience in the hospital setting. Children with ASD have communication impairments which can prevent effective communication between the patient and caregiver. Unfamiliar people and environments may cause stress or agitation in someone diagnosed with ASD. An additional concern for those with ASD is for their overall welfare and safety. Many children display disruptive or self-injurious behavior that could potentially lead to safety concerns when in the hospital. Studies indicate that pediatricians do not feel adequately prepared to care for children with ASD. Care plans may be one way to address the needs of patients with ASD in the hospital setting. The primary petitioner of this bill is Massachusetts State Senator Jason Lewis, a Democrat from the 5th Middlesex District. Co-sponsors include Representative Stephen Altrino, Representative Mike Conley, Senator Michael Moore, Senator Patrick O'Connor, Representative Kay Kahn, Representative Jack Patrick Lewis, Representative Marcos Devers, and Senator James Welsh. In order to have a better understanding of Senate Bill number 1287, it is important to be familiar with the diagnosis of autism spectrum disorder. Autism spectrum disorder, or ASD, is a developmental disability that can cause significant social, communication, and behavioral challenges. There is often nothing about how people with ASD look that sets them apart from other people, but people with ASD may communicate, interact, behave, and learn in ways that are different from most other people. People living with ASD may have trouble adapting to changes in routine and may experience unusual reactions to the way things smell, taste, look, feel, or sound. People with ASD may also have trouble expressing their wants and needs and may avoid eye contact. They may be unaware of people talking to them, but will respond to other sounds in the vicinity. It is important to note that ASD occurs in all racial, ethnic, and socioeconomic groups, but is about 4 times more common among boys than among girls. Please refer to the links below for more information on autism. If passed, this bill will provide an integrated state plan to develop training and education as well as standards of care by appropriate healthcare providers related to the diagnosis, treatment, and care of patients with intellectual disabilities, including autism spectrum disorder. This bill also seeks implementation of a strategy for the adoption of standards for improving assessment and diagnosis of intellectual disabilities, including autism spectrum disorders, for patients during outpatient primary care examinations. In coordination with applicable state licensure boards, appropriate continuing education related to intellectual and developmental disabilities will be required as part of licensure renewal. Within 6 months of enactment, this bill will seek to establish an advisory committee which will be comprised of the following: a designee of the Secretary of Health and Human Services, 2 healthcare providers with expertise in the diagnosis, treatment, and care of patients with intellectual and developmental disabilities, including autism spectrum disorders, 2 patient advocates or family members of those with intellectual and developmental disabilities, including autism spectrum disorders, and 5 statewide trade organizations that include the ARC of Massachusetts, the Massachusetts Health and Hospital Association, the Massachusetts Medical Society, the Massachusetts Psychiatric Society, and the Massachusetts Psychological Association. When looking at the policy's history and development, this bill was provided to Senator Lewis and to their House co-sponsor, Representative Carolyn Dykema, by the ARC of Massachusetts. Senator Lewis was the chair of the Joint Committee of Public Health last session and felt strongly about this bill when his office had a hearing on Representative Dykema's bill, House number 1889. Unfortunately, it did not make it to either floor for debate, but Senator Lewis wanted to take the lead with Representative Dykema. Every session, chairs move around on the Senate side, and Senator Lewis was named chair on the Joint Committee on Education. Both House Bill number 1889 and Senate Bill number 1287 had their hearing before the Joint Committee on Public Health on September 24, 2019. It is the hope of Representative Dykema and Senator Lewis that the bill will receive a favorable report by the committee. Each joint committee has until the first Wednesday in February of the second year of the session to get bills out of committee. Both Representative Dykema and Senator Lewis are hoping to have their bills put out favorably by the Joint Committee on Public Health. The official policymakers are those who possess legal authority to engage in the formulation of public policy. The formal actors involved in Senate Bill 1287 include the members of the Massachusetts Senate, members of the Massachusetts House of Representatives, the Department of Public Health, the Department of Developmental Services, the Joint Committee on Public Health, the Committee of Ways and Means, and the Governor of Massachusetts. Informal policymakers are not in government, but they derive their relevance in policymaking roles from the government and official policymakers. The informal actors include the Office of Health and Human Services, the ARC of Massachusetts, the Massachusetts Occupational Therapy Association, the American Occupational Therapy Association, Autism Speaks, social media outlets such as Facebook and Twitter, physicians, nurses, and related medical staff, parents and families, in addition to those living with intellectual impairment and autism. Using the logic model for analysis, the stakeholders of Senate Bill number 1287 and Act Creating Autism Teams in Hospitals clearly state their purpose by wishing to expand current hospital-based medical providers' knowledge about autism and intellectual developmental disabilities in order to improve the treatment individuals receive in medical settings. They propose to create an advisory committee which will oversee continuing education opportunities for applicable healthcare providers. We'll look to implement strategies for improving the standards of care and assessment, as well as coordinating with applicable state licensure boards for the adoption of appropriate continuing education requirements as part of licensure renewals. The committee outlined will serve as a guide or reference point for everyone involved in the passing of this bill and will offer their expertise in the planning, implementation, and evaluation of such programs, which would in turn enhance the likelihood of resource commitment. Ongoing research and programs from institutions within the state of Massachusetts can be used to align with the potential success of this proposed bill. Moving forward with this bill, one must consider the financial implications this bill could create on hospitals and medical centers. Creating autism teams in hospitals, developing caregiver trainings, and making environmental modifications could cost facilities more money in already tight operating budgets. Another thing to consider is the variety of cultural backgrounds medical professionals have in modern-day medical centers. Many physicians come from nations in which autism frequently goes undiagnosed or unnoticed. Therefore, they may not view autism as a priority and their training may be limited. Lastly, the language in the title of the bill should be reconsidered. The title reads, "An Act Creating Autism Teams in Hospitals," yet the language within the bill itself refers to both autism and intellectual and developmental disabilities. That perhaps could be misleading to the stakeholders. The passing of this bill would potentially allow occupational therapists to become involved as members of an advisory committee, which would serve to further educate and provide training to medical professionals within hospitals and medical centers. Occupational therapists possess the skill set to provide training to medical staff and professionals, design and implement sensory tools and modalities, make environmental modifications, and supply educational resources to staff. While some hospitals, such as Massachusetts General Hospital and Boston Medical Center, have already experienced the success of such programs, the passing of this bill would require all hospitals to carry out such standards of care for those diagnosed with autism and intellectual disabilities.